next at 7.
The death toll from coronavirus now stands at more than 130,000 people in the United States. Good evening, I'm Ryan Kennedy.
I'm Mariana Bennett. Thank you for keeping it here. The number of cases in the country has soared recently. It's now approaching 3 million. Chris Martinez reports.
The coronavirus continues to spread out of control in much of the U.S.
We are still knee-deep in the first wave of this, and I would say this would not be considered a wave. It was a surge or a resurgence.
Infections are rising in at least 40 states and the District of Columbia.
An outbreak anywhere is an outbreak everywhere. That's the new mentality we have to have.
The hardest hit areas include 3 of the country's most populous states, Florida, California, and Texas. In some cities, the hospitals are nearly full.
We are in one of the worst parts of the epidemic. This is the beginning. They will double in the next 2 weeks, and then double again the week after that.
On Monday, restaurants in Miami-Dade County were again ordered to stop serving indoor meals. Gyms and other public facilities have to shut down by Wednesday.
We might be getting locked down for another 3 months. What's going to happen to these business owners? We don't know. It's very scary.
Experts say COVID-19 is increasingly being spread by and among younger people.
15 to 44, that is where the bulk of these positive tests are now coming from, and particularly that 25 to 34-year-old age group.
Chris Martinez, 2 News.
There are now almost 23,000 confirmed coronavirus cases in Nevada, and the Northern Nevada State Veterans Home reported their first coronavirus death today, revealed as an 89-year-old veteran of the Korean War. Nevada reported almost 500 new cases since yesterday, bringing the total to more than 22,900. Clark County has more than 18,000 of those cases, and cases in Washoe County have topped more than 3,200. Officials say wearing masks will help battle the pandemic. Governor Sisolak made it mandatory late last month, and we could find out if it's having a positive impact in about the next week or two. The state is also finding out if businesses are complying with the order. Paul Nelson has more.
Nevada is in its second week of Governor Sisolak's mandate that people wear a face covering in public.
That was in order to help us maintain something like the stay-at-home order did previously, and that is stopping the spread, mitigation measures in order to stop the spread.
This IHME model shows the projections in Nevada. With eased restrictions and without a mask, the curve climbs to 923 positive daily cases by October 1st. But with everyone wearing a mask, the curve on the bottom drops to about 63 new daily cases. It's still too soon to see the impact of the governor's order, though.
It is important to note here that we are not expecting to see a decrease in cases from this mandate for another week or two.
This past Friday, officials checked in on water parks, bars, and casinos, and just over 3/4 of them were following the governor's face covering mandate.
I do like the increased compliance that we're seeing here. I think that's a positive. I don't think anybody is ready to rest satisfied on any of our compliance numbers right now.
State officials will look at a wide range of data as it comes in, showing how effective a mask can be.
We are going to be looking to see if the mask caused a decline in cases probably over the next 2 to 3 weeks, and it does really revolve around compliance and the wearing of those masks.
Cage says the governor has made difficult decisions to slow the spread of the virus.
That has enabled us to have a better understanding of how this virus behaves in the public and allowed us to meet his goals.
Covering the story, Paul Nelson, 2 News.
That Nevada's hospitals are doing a good job adjusting to the virus. Hospitalizations have been rising for more than a month, but the average stay is getting shorter.
Now, some of